Okay, thank you for joining me in this health education. We have a lot of questions that we received from the YouTube channel. ENT issue was definitely on top of anything else. So we had some question about the cancer, but ENT tops the other thing. So
Okay.
before we go on, I'd like to ask your background so that people know who you are and what kind of training background and what you usually do.
Yeah, sure. My name's Dr. Kevin Choi. I was born in Korea, moved to America in the middle of elementary school, and I did college, med school, residency training all in the United States. So I did my residency training at Duke University in North Carolina and also my fellowship training in rhinology at Duke as well. So currently practicing in Koreatown in Los Angeles.
So most of people who are watching my YouTube are Koreans. Well, everybody's Korean, but most of people are in Korea. So I think a lot of people are interested in what's the difference between the ENT in Korea and ENT in America. I don't know how much you know about ENT in Korea per se. How much do you know?
Oh, I know as much as you've explained to me before. So
Okay.
I don't see a lot of common colds or very acute issues in the
Hmm.
United States. For little infections, whether it's a cold, sinus infection, or ear infection, generally patients come to me after they've tried one or two rounds of treatment through their primary care physician or an urgent care center. Otherwise, the specialty is very surgically driven in America. So I spend about a quarter of my time in the operating room. The rest of my time is usually seen in clinic seeing patients.
So can you tell me a little about like surgery that you do in the OR and procedure you do in your office?
I think the office procedures are much more simpler. Anything on your face or on your neck that needs to be removed, I can remove it in the office. Or anything within your tongue, oral cavity, oral pharynx, tiny lesions that just need some pathologic diagnosis, I can address in the office. Ear tubes, minor ear surgeries and cleanings, and also just basic sinus work or things that we can all address in the office. In the operating room, I would say about 90% of my patients get general anesthesia. So whether it is endoscopic sinus surgery or cancer surgery or thyroid removal, these are all cases where patients are completely asleep.
Because most of our viewers are in Korea,
Mhm.
and when they see ENT as outpatient, those ENT doctors in Korea do treat a lot of common cold, and definitely that is not the work of ENT in America. So I like to emphasize that ENT in America, and which is you, will be doing a lot of extensive surgery, right? Including the cancer surgery.
But I think, if it's someone that has a well-established history with me, so someone with just chronic sinus infections or chronic ear infections, if they do get an acute exacerbation, I'll address it. But if it's someone that I have no history with and they're walking in wanting a upper respiratory infection or an acute ear infection addressed, it's going to be much more difficult for those patients to get in to see me.
Okay. Yeah.
Yeah.
And how many days of clinic do you do per week?
About 3.5
Okay.
currently. Yeah.
Okay. And your rest of the time you are in the operating room.
Yeah, about one to 1.5 days a week.
And you also do the ear thing with the hearing check and things like that, right?
Yeah, so I think that's a big misnomer also. So physicians don't perform audiograms or hearing tests. Those are all done by subset of healthcare specialists. They can be either audiologists or hearing instrument specialists. So there's a wide range of education that's involved there. So hearing instrument specialist, it's a certificate program. All you need is a high school degree. To be an audiologist, you can get a master's degree after finishing your college degree, or you can get a doctorate degree or an AUD. The depth of training determines how much of the nuances in hearing tests that you're aware of, and also what additional tests you can perform for the year.
we had a lot of questions from the viewer on ENT issue. And the second most commonly asked question in my post was tonsil stone. This lady, 20-year-old girl, had a several tonsil stone on multiple episodes.
Yeah.
And I think she went to ENT and she was told that to watch. But I think her mother is saying that I want to have a surgery done so that she doesn't have this problem. So that is the question. And I know that some people may never saw a tonsil stone before. So we are going to put some video, the photo somewhere around here.
Okay.
And when you have it, it smells, right? It smells. So I think the mother is concerned because she's 20-year-old girl, and we
Yeah.
don't want bad smell from her mouth. So what do you think about that?
So why do tonsil stones occur? Essentially, it's the epithelium of the tonsil sloughing off, just like how your skin sloughs off. And it gets trapped within the crypts of your tonsil. It smells because it gets mixed with food particles and whatever else that is in the back of your throat. And kind of imagine, when you go to sleep at night and you wake up in the morning, we all have bad breath from all the anaerobic bacteria that grows in our mouth. It's the same thing with the tonsil stone. Now, tonsil stones, they generally present it as these white chunks that are stuck in your tonsil. You can express it by pressing on the tonsil. But then similarly, when you get a tonsil infection, you can get white spots appearing on your tonsils. This is both bacterial and viral. And I've also seen lymphomas and cancers that causes tonsillar enlargement with white splotchy areas. So definitely getting the diagnosis correct is the most important part. Now, tonsil stones, they smell, they cause a huge impact on your quality of life. And people go from using their fingers to bobby pins to toothpicks to remove all this from the back of their throat. I actually suggest water picks. It's a pricey investment, but it's something that you can use to remove the tonsil stones. But at the end of the day, surgery is definitely an option. And you have to think about how much the stones bother you to pursue surgery, because it's definitely not a necessity. If the diagnosis is correct and that this is purely a tonsil stone issue, then your options include surgical options or just watchful waiting.
So if it is bothering you a lot and it's keep happening, probably want to do surgery if you feel bothered by it very much.
Yeah.
Right?
And I always tell my patients, tonsillectomy is probably the most painful surgery I do.
Really?
Oh yeah.
I thought you were going to say like the easiest one.
No, well, it's in children, it's very simple. I can probably get tonsils out within 5 minutes. In adults, it's usually much more bloody, and then it takes a lot more time. People lose so much weight because they can't eat or drink when they get the tonsillectomy done. So
it should be pretty bad before you
So
decide to do that.
I warn all my patients, this is the most painful and excruciating surgery that I perform for my patients. And you have to weigh that in deciding whether you're going to get surgery or not.
Then most likely that 20-year-old probably not going to do the surgery. Then what would be the next step? What can she do to improve this thing to recur less?
I'm not aware of anything that you can do to prophylactically. Dental hygiene is always recommended, but there isn't a huge lifestyle change you can make to decrease the frequency of stones.
Okay. So you just kind of watch and then use the water pick. Is that something that you can buy from like Costco or something like that?
Costco, CVS, they all have it.
The water pick that you use for your dental?
Yeah.
Oh, it's the same thing.
Yeah.
Okay, I see.
Yeah.
Oh. I see a lot of people use like Q-tip and then squeeze out or things like that.
Yeah.
And then there was a saying that if you do that, it may damage or irritate your tonsil more, and then you may end up having a bigger hole.
Yeah.
What do you think about that? The bigger hole?
I don't think you're going to cause a greater hole with something like Q-tips. My concern would be whether, like, if you use something like a toothpick or something sharp to get it out, you can lacerate your tonsil and cause a significant amount of bleeding. And you can also injure the back of your throat. I've seen I've seen patients with injuries from picking at their tonsils, or I've seen kids injure their throat from running around with a stick in their mouth. So those are the concerns. But, for quality of life surgery, like I explain, this is what you're suffering from, and this is what you have to get through in terms of recovery from surgery. So you have to weigh when is the benefit greater than the risks associated and the inconvenience.
So how long is the recovery time if you actually have a tonsillectomy?
Soft diet for 2 weeks, no exercise, no heavy lifting, greater than 10 pounds for 2 weeks. And you're also looking at no driving for 2 weeks because most often we're going to need to prescribe opioids to get you through the pain.
Oh, that bad, huh? The pain.
Oh, yeah. Oh, yeah.
So I guess I'm not doing it if I have one. Yeah, opiate.
No. So my post-op tonsil patients, they're on Tylenol and Motrin around the clock.
Uh-huh.
And kind of dependent on how much more severe it is, they'll get anything from Tylenol 3 to oxycodone.
All right, well, there you go. So if you have a tonsil stone, try to maintain with the water pick. Unless you are really suffering. I don't know how many people are willing to go through that surgery, but well, that's what we have. Thank you very much, and then we'll come back with another ENT question next week. Thank you. Bye.